Hello, everyone. Welcome to another episode of Psych Talk. Today's episode is going to be very interesting, and I will talk about Schizoid Personality Disorder and Schizotypal Personality Disorder, and obviously their differences. So, Schizoid Personality Disorder is very interesting to me because it's actually one of the rarest of the personality disorders, and people with this disorder usually tend to avoid relationships, and obviously they seek treatment rarely. It's not very common for them to seek treatment, and the prevalence of this disorder vary from 1% of the population to 5% of the population. So one of the features of schizoid personality disorder is the incapability for the individual to relate to other people and also to have the desire to form intimate relationships and even family relationships. And we can start seeing this type of attitude or behavior by adolescence or early adulthood. And so one of the common symptoms are social isolation or failure to communicate with others, and this has an impact on, of course, work, relationships, and it usually leads to not emotionally satisfying lives. They usually prefer to do activities that do not require to be in groups, so solitary activities. They obviously don't date very often. They usually don't get married. They don't really have interest in having a romantic nor sexual relationship. They experience anhedonia. They are not very excited about life. Yeah, they usually don't have much friends. They're not really close to family members. They don't really care about others' opinions, which I don't know if that can be good or bad, but they really appear detached and they lack emotional expressions. And to distinguish, obviously, these disorder from schizophrenia, bipolar, depressive disorder is, we have to distinguish this disorder from other disorders, and I'm specifically talking about schizophrenia, bipolar, depressive disorder with psychotic features, and a way to distinguish schizoid personality disorder is the fact that this disorder does not include psychotic features. So there are no hallucinations nor delusions. So schizophrenia, obviously, it has to include hallucinations and delusions, and schizoid personality disorder does not have, there is no presence of those symptoms. So usually men have the disorder more than women, and usually women that have the disorder are more likely to have a co-occurring alcohol or substance abuse disorder. And some of the symptoms may be present in childhood. We can see that they might be not socially involved, they're kind of detached. They have cognitive and perceptual distortions, eccentricities, and they have obviously difficulty making friends. And when they become adults, they don't really have a wish to change. They don't really find the motivation or the interest to change. Really few people have that. But the people who do seek change, what we can provide for them is cognitive behavioral approaches to help them with social skills, particularly with the trying to make friends and be more approachable. We can teach them be more self-expressive, and so basically it's good to approach this disorder with a behavioral point of view, so we can create a treatment plan that builds slowly on skills and abilities. Although people who have the disorder usually, first of all, they do not seek treatment, and the ones who do, they usually terminate the treatment prematurely because they usually lack the motivation to keep doing the treatment, and usually the people who are kind of like pushing this individual to go to therapy are like family members, friends, or employers. And now I will talk about schizotypal personality disorder. So this one is like, the person that kind of has this type of magical thinking and it's very superstitious and kind of odd and eccentric behavior, and they have kind of a peculiar appearance. Um, they usually have a solitary lifestyle, they lack friends, and they have a lot of social anxiety and paranoid fears. They usually become kind of isolated from society. They don't have much friends. They're usually bullied because of their eccentric mannerisms and the way they dress and their speech, the way they talk. For example, they can talk to themselves out loud. Again, they may dress or present themselves very oddly. They may not groom themselves. They may use a lot of metaphors or like uh, kind of like weird, odd speech patterns. An example could be also like, let's say, like this person has to go to a funeral, and instead of wearing like a black dress or black suit, they wear like a white dress. And this magical type of thinking and superstitions, um, they're not part of like religious beliefs, so they have to be like separated from the religious beliefs. We find also that these people have neurological deficits in the frontal lobe, similar to what is found in schizophrenia, which can cause obviously some of the symptoms. And so again, the disorder is characterized by an extreme level of impairments in personality functioning with 4 or more of the following personality traits: eccentricity, restricted affect, social withdrawal, suspiciousness, unusual beliefs and experiences, and disturbances in cognition and cognitions and perceptions. There is limited research in available treatment for these people, unfortunately. Um, Obviously, individual therapy can help, and building kind of a good rapport between the therapist and the client seems to help the client and draw the client in. Um, what could help is like a treatment that focuses on self-esteem and building confidence, and using very slowly cognitive and behavioral strategies so that we can help the clients achieve some sort of self-awareness in their behavior and how they present themselves. So we can help them in like personal hygiene, developing independence, try to be more social, and just have more insight overall. And so, as a summary, schizotypal personality disorder involves odd beliefs, behavior, and social anxiety with a tendency toward magical thinking, while schizoid personality disorder is characterized by preference for solitude, emotional coldness, and a lack of desire for social relationships. And that's it for this episode. I hope you enjoyed it.